Hi, this is Dr. Pinto. I'm going to take the next few minutes to show you some of the basic EFT points in the setup. And EFT, if you're not familiar with it, is emotional freedom technique. It's based on a system of acupuncture points in psychology. And this was put together by Roger Callahan many, many years ago. It's very, very effective, and I'm sure if you go out there and investigate it, you see all kinds of doctors using it in their practice and recommending it to their patients. It's been one of the easiest, funnest things that I've ever used in my office. So let's just go through some of the basic setup points to make this really easy. So there's always has to be a setup phrase, and the setup phrase can be blank, even though blank. So what that means is, let's take this for example. Always, before you even start, grade everything on a scale of 1 to 10. So let's say I have some lower back pain today. And it can be used for other things besides back pain, like sports performance, phobias, anxiety, depression, even to bring positive things in your life. But let's just keep it simple. I'm going to do a back pain phrase just because it's really easy to do as I demonstrate. So let's say that I have some back pain today, and on a scale from 1 to 10, it's an 8. So I want to make note of that and say my back pain's an 8. So one of the things I would do is I'd want to set this up with my brain and my body, and basically I'm going to be tapping some points. It's going to look kind of weird, but remember, acupuncture is a concept based on the way energy flows through the body. What you use is secondary to that. So tapping is one method, as needle is a method, as laser is a method, as electricity, and so on and so forth. So you're going to set this phrase up with the brain and the body, and there's going to be what they call a karate chop point, which is going to be right here. And what you're going to do is, I like to use 4 fingers or 3 fingers, because then that way you can't miss the point. And you're going to say, even though I have this back pain, I love and accept myself. Even though I have this back pain, or we'll say lower back pain, I love and accept myself. Even though I have this lower back pain, I love and accept myself. And I recommend tapping this at least 3 times. And you can tap it more. You know, I always tell people, follow your intuition. That's a great thing to do. And then we're going to go to the next point, which would be the eyebrow point, which is going to be right here. And if you take 4 fingers and you just kind of tap lightly along your whole eyebrow, it's pretty hard to miss it. So even though I have this back pain, even though I have this lower back pain, even though I have this lower back pain. And then the next point is going to be on the side of your eye, right here in the temple. And you can use 2 fingers, 3 fingers, 4 fingers, whatever you're comfortable with. You don't have to tap real hard, just, so you kind of feel it. Even though I have this lower back pain. Even though I have this lower back pain. And I know this looks weird, but it does work. It works very, very well. And then you're going to come under the eye, which is right here. You're just going to tap right there. Even though I have this lower back pain. Even though I have this lower back pain. And if you're not tapping, just go ahead and tap with me. Even though I have this lower back pain. Next point is going to be under the nose here. So right here in the crease of the nose. And again, I like to use a bunch of fingers so I can't miss the point. Even though I have this lower back pain. Even though I have this lower back pain. And I'm going to go to the chin, which is right here. So there's a chin point. I'm going to tap that right there and go, even though I have this lower back pain. Even though I have this lower back pain. Even though I have this lower back pain. And then I'm going to go right here to the collarbone. It's kind of tricky. You go find your sternum here, and you're going to slip off between your collarbone and your ribs here. You're going to find a sore spot. And you can usually tap them. Again, 4 fingers, you can't miss it. Here's the great thing about tapping. It's not like needles. You don't have to be right on the money. You got to be just in the general vicinity. Even though I have this lower back pain. Even though I have this lower back pain. Now, one of the other points that I like to use, but not everybody uses, is right here, is underneath the arm, right here. And a lot of times it's where a bra strap will lay. It's usually pretty sensitive on women, even though I have this lower back pain. Even though I have this lower back pain. And then there's going to be a point on top of the head, and one of the easy ways to find that is if you stick your fingers in your ears, your thumbs, come across the top of the head, and it's right smack in the center of the head here. Even though I have this lower back pain. Even though I have this lower back pain. And I recommend it first, just going through this a couple of times, maybe three rounds. Even though I have this lower back pain. Side of the eye, even though I have this lower back pain. Under the eye, even though I have this lower back pain. Under the nose, even though I have this lower back pain. Even at the chin point, even though I have this lower back pain. Chest bone, even though I have this lower back pain. Under the arm, even though I have this lower back pain. and then top of the head, even though I had this lower back pain. You could probably do that like 3 times, and then what you want to do is look at where you're at. So if it was an 8, where am I? Am I 6? Am I 4? You want to get it down to at least between a 2 and a 3, or 2, 3, and a 4. So I hope that helped you out, and look for the next video, and I'm going to go over some other techniques in EFT. Thank you.